Mental health workers of Reddit, what is the scariest mental health condition you have encountered? Story 1 Psych RN, not the scariest, but another condition I think people underestimate is OCD. Severe OCD can be totally debilitating to the point where it can cost the person their job, their family, and their life. I have taken care of patients who present to the hospital with suicidal ideation, because their OCD is so exhausting that they basically see no other way to get relief except to end their lives. People who are really particular about something and say, oh, that's just my OCD kicking in, have no clue. Story 2 I was in the field over 30 years ago. I think the scariest thing I saw was actually what broke me from the job. I was in CPS, and it was a case of a person who kept adopting and abusing, and the kids were abusing each other. Almost every person that worked on that case no longer works in the field anymore, because it was just too much on the soul. I bake cookies now. Story 3 I used to work as a clinician in a jail. I was doing a suicide risk assessment on a young man who was charged with strangling his mother. The first day I met him, I spoke to him through his cell door. He reported command hallucinations which told him to hurt people. The next day, I assessed him right outside his cell as he was coming back from court. There was a deputy present. He seemed very with it and optimistic. He knew what happened at court and told me his aunt was going to post his bond. Halfway through the conversation I saw something shift in his demeanor. I didn't realize this, but looking back at camera footage, I unconsciously took a step backward. He suddenly lunged for my neck and I ran down the hallway. He ran the opposite direction and was tackled by the deputy. His eyes still haunt me. Story 4 Not a mental health worker, but adjacent. I was working at a homeless shelter and a man who was staying with us was suffering from schizophrenia. His providers kept messing with his medications, switching him from one to another, or not filling his prescriptions. He spiraled hard, stole a knife from the kitchen, and slit his wrists in his bed. He survived, but holy, clients in the beds around him said they heard him arguing with himself, saying things like I won't hurt these people, you can't make me, etc. They felt that he did what he did to protect them. It was really scary, and even more sad. He was a sweet man, he deserves better. Story 5 Psychologist therapist here. Anorexia nervosa is one of the most scary mental health condition I've worked with, the deadliest of all too. There are a lot of people now struggling with EDs and it's horrific and very hard for every single person living though this. However, the classic purely restrictive anorexia nervosa can be close to psychosis. They starve themselves to death and you can't do anything about it. They don't see themselves as sick, they don't see their body as it is. Sometimes it seems unstoppable. And I also wonder how some people with anorexia survive so long without food and how they are able to over-exercise and undereat for so long. Most people thankfully would pass out and just struggle too much to keep this thing going. It's scary how their body can resist this torture, until it can't anymore. They will die from not eating, absolutely unable to force themselves to eat, and feeling like they absolutely want to live but can't eat. Story 6 OCD. Had a 20-year-old guy so tortured by his own brain and no medication would work. He would get stuck in these endless loops of asking if everything would be okay but never being able to accept the answer, and if you tried to answer with anything other than yes, it's going to be okay, he'd yell over you, repeating the question with increasing panic until you gave the correct answer, and then the process would start all over again. It absolutely tore his family apart, and then came the intrusive thoughts about his younger sister. The poor guy hated himself for making his family suffer so much and the thoughts he was having about his sister that he tried to end his life 3 times, once before admission and twice in the short periods between discharge and readmission. On the 4th attempt he succeeded in ending his life, and I've never seen a family so torn between grief, guilt, and relief. Story 7 10-year boy presenting very typical to above average in intelligence, looks, personality, etc. You wouldn't have given him a second look or thought anything was wrong with him if you saw him in your child's school. He was placed at our residential treatment center after he put his infant half-sister in a chest freezer and refused to tell the parents where she was. Now thankfully she was found quickly and was okay. But the whole time they were searching the house and yelling and begging him to tell them, he calmly sat there and refused with a small smile on his face. No history of abuse, neglect, head injury, birth injury, etc. When asked why, he said because he could. He enjoyed watching the terror on his dad and stepmother's faces. He also abused, adding it was in nature because of all the questions his younger roommate while at our facility terrorized the roommate, saying he would kill their family if they told anyone. After that his parents were given a choice by a judge, registered offender or DNA on the list. I believe they chose his DNA be put into a database. I watched the news for his name. It was definitely a case of someone who was born that way, a natural-born sociopath, scariest child I ever dealt with in 20 years. I had some very angry children, children with behavioral issues, children who disassociated, children who attacked others on a regular basis, but they all had a reason, so to speak. There was a history of intense abuse or neglect or organic brain injury or RAD or autism. But this kid had charmed the world and be a serial killer behind the scenes. Story 8 I already commented, but I also had another disturbing case of a 7-year-old that was horrifically abused by his parents. They dropped him off at the hospital unconscious and just left him. He had over 80 bruises on his body and his testicles were severely swollen. I'm not really sure what they did to him. I went to see him every day until he was transferred to a group home, and the poor kid would only speak by screaming profanities. I was able to finally get him to talk a little before his transfer, But I just couldn't help but imagine what he had gone through and wonder why. It was awful and will stay with me forever. Story 9. 9 to 10-year-old arsonist burning houses, churches, his multi-apartment house and finally, baby's crib with his baby sister in it. He put gas on her and lit her on fire. She lived but was horribly scarred. 9 separate structure fires. He was in my 3rd and 4th grade classes. This was all in one fairly small town in late 60s. Story 10. Young kids are the hardest for me. I had a 5-year-old plot, conceal, and then hold a paraprofessional who was in a wheelchair easier to overpower from behind with a knife to her neck because he, as he put it, was being told to do so by his brain thoughts. He was exceedingly strong for his age, weighed almost as much as she did, and he was exceedingly determined. Had they not been in earshot of others, it may have gone much worse. Thinking about kids who are downright dangerous to adults is really hard. We knew his family of origin. This was not a direct response to his external lived experiences. It was just what was in his brain, and he had to live in that brain as long as he was on the earth. It's maybe not as terrifying as being overpowered by an adult, but it's deeply overwhelmingly sad in other ways. Story 11. I was the director of operation at a mental health facility. I was property management, not psych worker. I saw a lot of on that job, but surprisingly to me it was Munchausen syndrome. We had one woman that had it. She was this bottomless pit of need. It was weird to be in the same room as her, as she instantly started wanting attention and sympathy, endless demands for sympathy. There was something so unnerving about it. Story 12. Not a healthcare worker, patient, but catatonia is pretty scary. When I was going through electroconvulsive therapy, I'd see other patients go from completely frozen in time nonverbal to suddenly talking and being animated again. The human brain is wild. Story 13. TBI. I can handle all the schizophrenics and bipolars in the world. They can be reasoned with and treated. But people with severe TBIs can develop major issues with lashing out uncontrollably and often. I've worked with several that will be sitting calmly and then suddenly punch people in the face for no reason at all. There's not a whole lot that can be done to help them, and it's really sad. Story 14. People with true antisocial personality disorder are pretty scary. They really don't have a conscience or any of the empathic qualities that make humans more than just smarter animals. They will hurt you to get what they want without a second thought, or just because they find pleasure in it, and there isn't really any treatment for it. Story 15. I didn't specifically work in mental health, but I did work in a long-term care facility nursing home. I worked on the secure unit, mostly seniors with varying stages of dementia. The average age was probably early mid-80s. We had a resident move-in who had Korsakoff syndrome. It is a type of dementia caused by alcoholism. It was pretty advanced, like she could not tell you where she was or what day it was. She was 34. Dementia is an utterly horrible disease, but to know that hers was preventable and brought on so young because of her own actions, although I know alcoholism is a terrible disease as well, was really difficult to see. And then to know that the system couldn't support her anywhere else, and so she has to live her young life in a nursing home is really sad. Story 16. Schizophrenia with command hallucinations. Young guy on meds, refractory case, got off his own penis. They sewed it back on, but I can't imagine that it's been the same since then. Story 17. One of my clients went from being okay one day to hearing stuff that wasn't there, being afraid all the time, slowly going nonverbal and having stupors, strange mannerisms he hadn't displayed before, and unable to do simple tasks like drinking from a cup the next day. He slowly grew more nonverbal, anxious, confused, and stiffen up. At one point he would just walk in circles in his room, call you weird names, and not sleep for days on end. We have fought to get this kid professional help for 2 weeks. Then he finally got admitted to the hospital. Turned out he had catatonia, which is a rather complex neuropsychiatric syndrome that disrupts how your brain works. They told us he was actually close to death at that point. He needed months of different therapies before he got better. Story 18. Being on an adolescent psych floor is heartbreaking more than scary, but I wanted to post about it because it was really jarring to see how children's mental illness is present. I was around kids from 10 to 16 years old, and they almost all had some form of disordered eating, because of all the ways they didn't have control in their lives. They could control eating. We had one preteen who had been severely abused. They wouldn't eat or speak to anyone for months, so they had to have an NG tube put in, tube that is inserted into the nostril down into the stomach so they can be tube-fed. Another very sweet and polite kid that was totally pleasant on the unit had horrible command hallucinations, constantly telling them to kill their family. Mental illness destroying lives is never easy to watch, though watching children struggling is another level of heartache. Story 19. The scariest condition aside from dementia would be schizophrenia. I can't imagine what it's like to have that diagnosis. I know there are degrees of severity, but to see things that aren't there, that are mostly frightening in nature, to not know if you can trust your own family or doctors there to help you because of the fear and paranoia you constantly live with, it must be. And for any mental illness, there is no cure-all, and it takes years to find a balance of meds that works well if you're lucky. Some people who find medication for schizophrenia find themselves feeling like a zombie on meds, and the other option is to feel paranoid, afraid, or catatonic. I have personally seen some truly awful trauma in children, though, from them being placed in the ER for stabilizing and placement. I've seen a hypersexual and violent 5-year-old girl that only ended up that way due to trauma, and it was awful to see and to manage. There was also one child I cared for briefly that had a history of violence towards family members and animals, and had zero remorse or emotions regarding it. I got serious vibes that he would hurt, kill someone in the future. Psych can be so sad to specialize in. Story 2017 years old with severe NPD and APD, HX of harming animals. Family tiptoes around them and enables. About to turn 18 wants no parental contact. Will refuse psych treatment as soon as he is able to. What will come of this individual? Story 21 I work with a lot of kids who have issues. We had 5-year-old boy who beat his little sister nearly to death. They surgeons literally had to piece this poor little girl's face back together like a jigsaw puzzle. Story 22 Community mental health and substance use outreach RN here. Opioid addiction. Some of the people being dehumanized on the streets were regular people a very short time ago. The combination of the power of addiction and society's disdain and hatred toward those in poverty who live with addiction, it's horrible with how badly they are treated and dehumanized. Edit to all the other people who don't work in this field who are posting their experiences. I feel you. But the things you've seen and witnessed are typically one-offs, or really rare instances. However, the scope of the opioid crisis and sequelae of illnesses associated with it are unmatched in modern society. Story 23 To be honest, bulimia. I worked in a hospital for people with severe eating disorders for years. The desperation of these people, they would do anything to not gain weight, including vomiting in their clothes, in puzzle boxes on the unit, they would hide it in shampoo bottles, they would take massive amounts of laxatives. 100 per day. Sometimes they put things in their rectum before they get weighed in the morning so they weigh more. They ruin their teeth, they ruin their stomach, they get such electrolyte imbalances that they literally have heart attacks. They end up with colostomy bags from the abuse on their GI tract. They legit die. It's a disgusting disease. Story 24 It's less about the condition for me, and more about how it presents for that person. People who are mentally unwell are often more vulnerable than anything. I don't think I would describe any conditions as scary, heartbreaking, and devastating maybe. Story 25 I knew someone with schizoaffective disorder. She threw herself through an apartment window several floors up, convinced she was being chased by demons. What her last moments must have been like haunt me. She had been to the ER earlier in the day, but they did not admit her. Very sad. Story 26 When severe autism, psychosis and learning disabilities are all in one person, it's pretty scary. Guy I work with is completely nonverbal, very unpredictable and violent. The scary thing is when something causes his to tip over the edge, it's just pure rage and aggression with no understanding of consequences or his ability of causing serious harm. It is primal, animalistic rage. Less than half of the time you may get some physical warnings, if you're very vigilant, but most of the time he can appear content, and then turn on you. He will use his full strength to attack you and you can't do anything other than try to get him off you and run away. We aren't allowed restraints at my project. Story 27 Discounting child abuse. A certain type of auditory hallucinations. Think of voices coming in at levels. If you heard someone say something on a TV show, you would be able to completely ignore it and think of it as nothing real. Then you have someone speaking directly to you, which you take more seriously. Then you have thoughts you may have and you can think about, like I should do laundry. You can consider that and choose not to do it, even if it's clearly your own thought. Then there's the absolute instinctive things, coming in behind your ability to think about them, like wincing or just walking. You just do it. I worked with people on all of those levels. One person though, the voices were at that lowest level. When they said to cut herself, she'd just do it. She couldn't stop it. She couldn't tell anyone it was about to happen. There was no conscious choice. The amount of medication needed to make it stop basically made her catatonic, so that sucked. Story 28 When a police officer has antisocial personality disorder, you can't fire him because the police union supports him. He beats his wife and kids, but there's nothing you can do about it because everyone at the police department is his friend. His wife and kids can't hide at the shelter either because he knows its location. You can't take away his gun either because it's for official law enforcement use. A lot of times he ends up killing his wife. You saw all the signs but you couldn't do anything. Story 29 I was a psych nurse for a year and I could name so many. I'd say synthetic marijuana-induced psychosis was frightening because it could happen to anyone. I'd see lifetime smokers, med students, gangsters, mothers, you name it, completely normal people who became extremely psychotic for weeks or months. One med student was found running around campus naked yelling that his roommate was going to kill him. These people were essentially ruining their lives until someone was able to force them to be admitted. One of the scariest parts is that a lot of them didn't remember anything from that time, maybe for the best. I honestly compare it to being possessed. The person you actually are is locked away somewhere else in the brain, while this parasitic demon is running on pure visceral emotion. Story 30 I searched this topic with Post just to see if postpartum psychosis would show up, and to my absolute amazement and relief it did. I suffered from this, and I had all the help a woman could ask for, a husband who cared, in-laws who stayed over. It was my second child and I didn't have any issue W my first. I didn't anticipate any issue W my second. It took me over a year to recover, over 2 years to feel like myself. I only hope if anyone who reads this is struggling, and felt the way I did, I promise, hang on, there's an after, it's okay, you've got this. Story 31 I worked on a catch-all med surg floor. We were the de facto medical psych floor. Essentially patients who medically too unwell to be in psych we would treat, and then move them to psych. I will never forget this patient. They had actually been a worker on the floor prior to my starting, so I often ended up as their nurse because I was one of the few people who hadn't known them prior to their breakdown. They had been horribly abused by their father. and had kept it together enough until they had their own kids, where they then had a total breakdown which led to a run of constant suicide attempts. They would be found in a suicide attempt, usually by their poor partner, and then placed on a psych hold. The attempt I remember most was after they had been discharged after slitting their wrists, and their partner caught them overdosing on pills, straight back to hospital, where they were catatonic. Suicide attempts always have a one-to-one. Basically someone is just sitting in their room 247 watching them. They had been doing better, so weren't in restraints. Right at the end of my shift, the patient made a run for it, bolted upright and were heading for the floor doors. The poor CNA was dragging behind them, and even when I grabbed onto them they just kept pushing forward. I was easily 80 pounds heavier, and this tiny waif of a thing was moving steadily towards the door. It took 4 fully grown men to get them back in bed and in restraints, and that was with medical intervention B52. All the while the charge nurse and other colleagues who knew the patient before crying and pleading the patient to stop, while the patient just had these blank empty eyes, nothing there but the desire to escape and hurt themselves. I had to call the partner to let them know what happened, and that poor partner just sounded so defeated, so exhausted, raising the kids and trying to take care of their partner, all in a system which cannot or will not care for them. There were many mornings I cried after night shift on the train home. This was one of the times I sobbed. My own grandmother had killed herself drowning, as had her sister hanging, and my cousin had attempted many suicide attempts, but is still here. What happened to them? What happened to this patient? I can't think about it too much. Story 32. I'm not the worker but the patient. Scariest condition is my depression. My mind will race straight to suicide, and it's a loop of me hanging myself or shooting myself. I know where the suicide will happen, and my mind has written the note he'll leave. This happens every day, several times a day, and can last for sometimes over an hour. Story 33. I don't know what it would be classified under, but this is a story for my grandmother. She was a custodian in a place called Bayview Mental Hospital before working for Sharp. It was a place in the 70s where people of all ages would just get dropped off by families to become ward of the state. There was a boy she said couldn't have been any older than 9 or 10, and he was physically abused when he came in. Certain patients had single rooms with no day room privileges. Every day she would have to wait for a guard to cuff these patients so she could go in and clean their rooms. The boy would talk to her so sweetly and ask her how her day was, tell her things like she was his favorite person there, etc. She said she would go home and cry thinking about him. Then one day while waiting for a guard he said, "Hi Mrs. Sue, I think I'm going home today." And when the guard came to cuff him for her to clean, he attacked him with a pencil, stabbed him through the cheek and arm before the guard was able to subdue him. He had coached another employee for paper and pencil so he could draw. Instead he sharpened it to a point and waited for the guard. She said watching him go from a sweet child to an attempted murderer in a split second scared her more than the attack did, and she had a hard time trusting anyone after that incident. Story 34. Not a doctor, but I think the scariest thing is psychosis. You can't trust the person suffering it, to do what they say or to remain in control of their body. It's full-on crisis aversion at times. Having dealt with it before, I know how terrifying it is to lose control of the driver's seat. It makes it difficult to trust any professionals or forms of help, which ends up putting them at risk in addition to ourselves. It's a serious place to be in, and anyone suffering psychosis in any form deserves the attention and the fragility they need in order to heal. Have some grace for strangers. Everyone just wants to be loved and appreciated so we can be happy and heal in peace. Life is not easy for anyone. Story 35. Unreported homicidal ideation. I worked front desk and had a client come and fill out paperwork, get scheduled for screening, and then go on to murder a family in their home and cut out organs to consume. It really put into perspective how much can be going on in a person's head they might not show or understand. I think about it sometimes because what if whatever that was presented itself while he was in our office? Story 36. Dissociative identity disorder. Patient was recovered by the FBI at 4 years old after being repeatedly assaulted and filmed from infancy. She was adopted by a very nice older couple who did their best. She had 5 kids in her teens and 20s. The last 3 were with a stable and really good man. All of her children went into the foster system when he died. She died years later from addiction. All of her children are struggling with the fallout. She did her best and loved her kids, but nothing could heal her or stop her from splitting. Story 37. Equivalent to a social worker but called case manager for folks with mental health issues. I was in charge of treatment plans, med management, patient advocacy, helping teach independent skills, occasional therapy, and mostly helping stabilize their life. I also help build social connections and try to empower them to have positive community connections and responsibilities that left them feeling fulfilled. I don't think there is a disorder that's the scariest. I worked with folks with schizophrenia, bipolar, borderline, OCD, autism, PTSD, anxiety, depression, and many more. For every person with a disorder that made me feel scared, unsafe based off their behavior and thoughts. There were 5 other clients with the same disorder, totally sweet, kind, and their flare-ups were very self-contained and not alarming towards others. It was mostly difficult, miserable, scary to be the person suffering, not being the person trying to help. However, the scariest incidents have always involved a car while driving. One schizophrenic thought we both were imaginary and he could grab the steering wheel and crash us, and would respawn like a video game. One borderline client started screaming because she was angry I wasn't her normal provider but filling in. She threatened to attack me. She was previously acting normal. I guess she read a text that triggered her, It was wild. One minute we were joking and having a good conversation, building rapport. The next I was being screamed at. One person with OCD kept telling me which women we drove past he was thinking of raping. He likely had another disorder, but he never spoke like this around male workers. And his case manager was a man. I was just filling in. One person with bipolar kept telling me inappropriate things and was trying to convince me to have. They were really graphic and it was an hour car drive. I had to keep giving talks about boundaries, but he would threaten to violate them. One guy with depression started screaming at people outside the car. He was offering to fight them. This was in poor neighborhoods that people had guns and some folks were a part of gangs. None of these clients were my own. I was filling in for coworkers. I rarely work with men anymore, and when I do, I never ever transport clients. So yeah, for me it's not one disorder. It's basically a client that has been aggressive tendencies towards women or when they are upset. Story 38. My neighbor was a psychiatrist. He never divulged patient information but did share some odd cases. He told me that one woman had constant headaches brought on by all the needles she shoved into her neck and skull and everywhere else. He also had someone with a water drinking disorder which can kill you. Story 39. I saw a client in jail who had destroyed his mental health using K2, full hallucinations and delusions, and it was my understanding that he was a fully functional adult before using that pseudo-weed. It was enough for me to warn everyone I know to stay away from that stuff. The guy was talking about angels and demons and killing people. He had no sense of reality left. Story 40. Psych nurse here. Charles Bonnet syndrome is deeply unpleasant. Basically, people with severe sight loss experience visual hallucinations. It's terrifying for them as they've lived their life vision impaired and all of a sudden they can see and it's nearly always awful things. Recently looked after a man with JT who consistently saw snakes coming through the walls. It's terrifying. Story 41. I'm not a mental health worker, but I lived with someone who had anorexia. Terrifying. I have PTSD relating to his condition, though he's better now. Story 42. Borderline personality disorder can be frightening because it looks like so many things if you don't take a step back. It's a high suicide risk, but patients don't trust authority figures like doctors to properly treat them. One patient was, by most metrics, undiagnosed borderline. They frequently lied to providers, staff and police, were highly combative, and relied on underage family to manage their life. Depending on the month, there was a new disorder they were 100% convinced they had. One was schizophrenia, around when TikTokers would film their altars for clicks, which they used to explain their violent outbursts against family and strangers. The only real treatment for borderline is psychotherapy, which many of them are immediately opposed to. If they do accept it, the lies can build up until therapists discharge them since they can't treat them. A lot of people with borderline fall through the cracks, wind up in jail or on drugs, and cut their families down the middle between we have to help, and but they won't accept it. It is by and large one of the more exhausting diagnoses for family and caregivers. Story 43. I work in child psychiatry and have treated some kids that developed a functional neurological disorder because of childhood trauma. Even though their bodies were working like they should, they were unable to walk, talk, etc. It's crazy how fast regression occurred. One day they were able to nod, the next we needed them blinking once or twice to communicate. Story 44. Psychologist here. I'd say any cluster B personality disorder, especially ASPD and BPD. My second bet would be psychosis induced by severe insomnia. It is simultaneously the saddest yet scariest thing I've seen, where they become completely unpredictable while hallucinating God knows what. Story 45. My wife can't make any new memories, ever, remembers things for roughly 1 minute at a time. I'm forced to repeat everything, always. That's scary to imagine, but real. Story 46. Scariest saddest. Not a mental health worker, but I've known a few young people with severe Prader-Willi syndrome, little kids eating themselves to death, the absolute fury in their eyes when steps were taken to prevent access to food. Eating from the ground, eating anything and everything, and not able to understand the harm they're doing to themselves or the people around them in their efforts to obtain food. Parents watching on, horrified, confused, confronted. Story 47. I'm so late, but this was my worst. Husband and wife from the US adopted 2 kids from another country. A sister 7-ish at the time and younger brother 2-ish at the time. The sister strangled her adoptive parents' cat and dog to death. She left both of them on her parents' bed to find. No remorse, no empathy, no sadness. She sat and colored. Told me about the most recent long-term facility she stayed at, and how the nurse was scared of her. She seemed prideful, almost. She passively stayed, in the most unremarkable tone, that she was going to kill her brother next. She was in and out of long-term care following the time I worked around her case. Her parents had to lock her door from the outside and their house was more or less completely baby-proofed, but for older kids. Nothing sharp, locks on the silverware drawers and kitchen supplies. No scissors anywhere. It more or less broke me. I went home and cried after that first appointment. The adoptive parents did everything as right as they could, therapy, tutors, great home and school, all their needs met, open to communication. They were trying their best. And their best still didn't work. You can do everything right, and it still may not work. I have left the field since, but I hope they're all much happier and healthier now. Story 48. Mental health peer worker. There's 2 that come to mind when I think about what's been the scariest I've come across. One was someone with a traumatic brain injury, TBI. The instant shift into a violent urge was incredibly scary to witness. and there's not a thing anyone can do about it. Therapy doesn't work, and neither does medication. The other is anyone with NPD narcissistic personality disorder or ASPD antisocial personality disorder. I feel like people with ASPD can do well with therapy if they want it. They can be shown that working with other people, and working in a mutually beneficial way makes their own livia better. They have to do a lot of work though, and usually it's when they pick up the ASPD traits early on in life. But NPD always scares me. That could be my own personal experiences impacting on it, but I'm not aware of any therapeutic benefit to treating them. I could be wrong. Their egos are made up of a fake outer shell, and any attempt to work on, or point out the wound deep inside crumbles the shell. They protect it with every tactic they have, sometimes violently. Actually, if they are in treatment, it can make their manipulation and abuse worse because they learn therapy talk and use treatments as new tactics of control. Very scary stuff. Edit grammar. Story 49. Sociopaths. Smart antisocial ones. Nothing, and I mean nothing, scares me more than those things. To be clear, it's not because of what they do. Folks on drugs and dealing with paranoid schizophrenia can also be unpredictable and incredibly harmful. Furthermore, antisocial sociopaths, a lot of them at least, are trying to stay out of jail or trouble so they don't act like they do in horror movies. The thing that scares me is that they look like us, and in most ways behave like us, but are missing that fundamental part that in my opinion makes us humans. What I mean by this is that for most of us our objectives revolve around other people. We want friends, family, affection, respect, love, etc., and seek to also share our lives and provide for others. Our goals, life itself revolves around others. Our pack, so to speak. This is true for people in all walks of life in every situation. For example, a starving person might give their scraps of food to another who is starving. A cruel jailer might feel empathy for a younger or older prisoner. And even during times of war, enemies save one another from death and or pain. For sociopaths, life is a game. A literal game that no one else knows the rules. Even if you are somehow beating them, they will just change the rules and you will lose. Nothing is off the table for them unless it undermines whatever other objectives they have. Killing you absolutely crosses their mind, but it's usually not worth it if it means they have to stop dominating, grinding the will to live out of their wife, poisoning their family for attention, pimping out children for power over other child molesters, or trying to convince other young adults at the shelter to kill themselves, etc. What they do find worth doing they will do, and you never know what that might be. I can promise you though that if you see them or treat them as humans, they will get one over on you, because in reality they are a facsimile of a humans, with all the biological components but missing the part that makes us want to be a member of the pack. Sitting with them, interviewing them, trying to treat them, you get a strange feeling in your gut like you absolutely need to flee, but your brain is telling you that there is no data to support that impulse. You kinda struggle to make sense of it, and sometimes I experience it as feeling shy. I'm not shy though, y'all, that's my brain tripping over the monster that's in the room with me. Story 50. I'm out, so not much. You get the daily suicidal callers, but a lot of it is just pleas for ADHD meds. I would imagine endpoint is much worse. I heard dementia is pretty heartbreaking to watch.